trillion in national debt with tax breaks to billionaires and big corporations, and they make middle-class families in San Francisco and across America foot the bill by ripping away health care from millions and sneaking food away from children. I think many of you know that children have always been my motivation for leaving home, going into politics, and for the children, that 1 in 5 children in America goes to sleep hungry at night. In America, 1 in 5 children, and 1 in 5 those children live in poverty. So when I see 100,000 people, including over 20,000 children in San Francisco on Medicaid at risk of losing their health care. By the way, Medicaid, and I make this point with my colleagues, especially, Medicaid is viewed as a poor children initiative, and it is, and that's enough justification. But it's a middle-class benefit as well, because middle-class families across America use Medicaid funds. A great deal of Medicaid funds are used for health care for seniors, long-term health care for seniors. There's long-term care. Instead of having family members live at home, upstairs, downstairs, guest room, with other challenges that they have, they're cared for in long-term care under Medicaid. So when you look at the polls on this, say Democrats in the 90s support Medicaid. Independents in the 80s support Medicaid. Republicans in the 70s support Medicaid. Even in the low 80s, some of them support Medicaid. So when they say they're going to come to the table and cut Medicaid, we have an argument against that. So we will be making that fight. SNAP, nearly 40 million people in San Francisco count on SNAP to put food on the table or under threat. Last year this time, when we were waiting for the funding for Ukraine, I said to the speaker, I said, Mr. Speaker, people are dying. You've got to move this funding for Ukraine. He said, well, I can't do it until I finish the budget, which was postponed until March. It was around now, a little later. You know what the issue that was holding up the budget? WIC, food for women, infant, and children. They were holding up the budget. And now they're giving $4 trillion to the richest people in America. A repeat of what they did the only time they passed significant Republican legislation when the president was president before, President Trump, and the Republicans. They've had a $2 trillion addition to the national debt, giving 83% of the benefits to the top 1%. And they're complaining about WIC. I mean, really. So we put through 32 amendments for this process, and they rejected every one of them. But members are saying to their leadership, this is hard because the 70s Medicaid support, Republicans support Medicaid. How are they going to explain to their constituents that this is leaving? And so that they're hearing from them. And why they're hearing from them is because people are hearing from you. You know, the grassroots message, the outside mobilization means everything. We couldn't have passed the health care bill or saved it without the outside mobilization. And that drumbeat across America, which will intensify, is what the Republicans are hearing in their districts. So we're united in going forward. When we did the Affordable Care Act, some of you participated. We had 10,000 events around the country of people telling their stories. It's the stories. It's not the provisions. It's not the polls. It's the stories that people tell about their experience. So in any event, we will be active saving the Affordable Care Act, all of these initiatives. But we have such a strong argument on Medicare, Medicaid, and Social Security, all of them, 90s, 80s, 70s, in public polling now, and they don't even realize the threat. Everybody doesn't even realize the threat it's under, so that'll even go higher. But again, now we're really at the time of starting our meeting, and I've come here to listen, as I said. We stopped them in 2017. We'll stop them again in 2025. And the reason we're going to do it is because of the stories. Again, thank you for the hospitality. I'm in the San Francisco Marin Food Bank, and we're going to pleased to yield. I'm pleased to yield to Noriko Kim Lepper, who's going to tell us the story that she came here to tell us today. And it is going to be pretty exciting for us. She's the Advocacy and Voice Officer for the San Francisco Marin Food Bank.
Thank you, Speaker Emerita. I just want to start off with say I am so grateful for your leadership and for your advocacy for working families. And almost every day I tell my 7-year-old daughter, we are very lucky to have a woman from San Francisco advocating for us.
Appreciate you saying that. Thank you.
As many of you know, the mission of the San Francisco Marin Food Bank is to end hunger. The food bank isn't just a nonprofit organization. We are part of a community working together to make sure neighbors have food that they need today, and we advocate for the solutions that will end hunger tomorrow. We do this because we envision a future that's free of the root causes of hunger, where everyone has access to nutritious food of their choosing and is uplifted by a network of support. We believe food is a human right. We are committed to providing healthy food to residents of San Francisco and Marin County who qualify for assistance regardless of their immigration status or identity. Working with a network of more than 300 community partners and 215 neighborhood pantries, this past year we served 53,000 households comprised of seniors, young children and their families, and people with disabilities every week. Nearly 70% of the food we provide is high-quality, healthy produce, and we know this by surveying our participants, where 95% of them had said they enjoyed the food they received from the food bank. But it's not enough to address hunger as we see today. That's why we are co-creating solutions to end hunger with innovative community markets that allow participants dignified choice and access to supportive services, like applying for the Supplemental Nutrition Assistance Program, SNAP benefits. As of December of 2024, there are over 5.5 million people enrolled in California's SNAP program called CalFresh. In San Francisco and Marin counties, that includes 124,000 individuals who have access to healthy, nutritious food through CalFresh. Anti-hunger programs like CalFresh and SNAP work, but it, and among other vital nutrition programs that are part of the Farm Bill, are under threat. If the program is cut, tens of thousands of San Franciscans and people from Marin County could be impacted. Our neighborhood pantry network is still recovering from the pandemic and will be overwhelmed. Other endangered food security include the Emergency Food Assistance Program, TFAP. About 28% of the food we distribute is through TFAP, and a cut would mean our participants would simply receive less food, especially our senior populations. Cuts to the Local Food Purchasing Assistance Program, LFPA, would sever our relationship with a collective of Black and Indigenous farmers and reduce equity and access in our food supply ecosystem. While all this has the potential for a severe hunger crisis, our food bank will not retreat from our mission. We are committed to our community and our network of 300 partners. We know the need for us to work together and address hunger and continue the safety net for our partners. The need to come together is more critical than ever, and I'm very grateful for all of you being here. Thank you.
Thank you, Noriko. And now we're going to hear from Shakira Simley, Executive Director, Booker T. Washington Community Center, which feeds the children. Thank you so much, Shakira, for being with us. Thank you.
Thank you so much, Speaker Emerita Pelosi. We appreciate you so much. And thank you to my fellow advocates. So my name is Shakira Simley. I'm the Executive Director of the Booker T. Washington Community Service Center here in San Francisco. We are an anchor institution, community center, and affordable housing site. And we are San Francisco's oldest Black-led organization with 106 years of direct service to the community. Over the past several weeks, our community has been heartbroken and enraged and fearful at the relentless rhetoric and onslaught of executive orders that seem to surgically target my staff, our clients, and our community. When you slice through our social safety net, you slice through the hearts and bellies of our grandmothers, our aunties, our children, and our toddlers. And let me be clear, these GOP cuts are deadly and will have dire consequences towards those who can barely walk, talk, or vote. We're already seeing it on the ground here at Booker T. We serve over 6,000 of San Franciscans' most vulnerable folks every single year with access to free childcare, fresh local food, housing assistance, therapy, and counseling and essential services. This morning, and I apologize if I get a little emotional, I spent my morning counseling a mom who just had to reach out to us because she has to bury her 5-month-old. And while we're able to help and do that, I'm proud that she can come to our doors next week and get access to free culturally competent therapy. She can get access to our wellness groups, and she can make sure that she can press on and get support from our Black Infant Health Connects. I'm not sure if I'm going to be able to do that later on this year. Again, these proposed cuts are a death sentence to our community. Over 50% of the babies born in California are born via Medicaid. These are our Booker T kids. Over 90% of our working families and seniors, of the 1,500 people that we feed every week, are enrolled in SNAP or WIC. And when critical investments like housing vouchers are forcibly stolen, our foster moms that I house every single day will end up on the street. I already have dads at Booker T who are afraid to have their kids walk to school for fear they won't see them again, for fear of law enforcement. My employees who are essential during the pandemic are unsure if they'll have a job in the future and be able to have a future in the city in which they grew up. And again, I want to echo the speaker's comments. It's not just about our low-income families, or it's also our moderate and middle-income families as well. My parents who are bus drivers and nurses, they're not making the rent. They're skipping meals. They're skipping doctor's appointments, right? And there's no relief in sight. Breaking the backs of poor or sick kids and families will not make America great. We'll continue the fight alongside our San Franciscan leaders to preserve our life-saving programs here at Booker T. But I also want to say that compassion has no political stripe. And I want to thank Speaker Pelosi for your fire and your fight, as always. We'll brace ourselves for hard times, but we'll never abandon our people. Thank you.
Next, we're going to hear from Julie Walters, parent advocate, founder of the Connected Parent.
Thank you, Speaker Emerita Pelosi, for having me here. I'm the proud mom of 2 incredible kids, and I'm the founder of the Connected Parent, which is an online platform that helps families like mine, families who are raising children with disabilities, find the resources and support that they need. But most importantly, I'm here today as Violet's mom. Violet is my oldest. She has a rare and complex form of epilepsy called PCDH19 epilepsy, which is caused by a spontaneous gene mutation. She also has an intellectual disability and is autistic. She's also funny, creative, and kind. She loves music, school, and helping out at the Connected Parent. But she also faces daily challenges that require ongoing care and support. Violet had her first seizure at 11 months old, and it completely changed the course of our lives. That seizure was the beginning of thousands more, sometimes dozens in a single day. Each one was life-threatening. Each one came with the terrifying reality that she could stop breathing. The first several years of Violet's life were spent in and out of hospitals. She was hospitalized numerous times, and our medical bills quickly added up to hundreds of thousands of dollars. I will never forget the stress and the fear, not just for Violet's health, but for our future. We were drowning in medical costs, and I was constantly afraid that we would run out of coverage before the ACA and have nowhere to turn. That's why Medi-Cal, California's Medicaid program, has been such a lifeline for us. Today, Violet qualifies for Medi-Cal due to her disability. We also rely on IHSS in-home support services, which allow us to get help for her at home. These programs enable Violet to live safely and comfortably in our home. And they give me the peace of mind that she's getting the care that she needs. Through Medi-Cal, Violet and other children with similar disabilities receive things such as medication that controls her seizures and her other health conditions, specialists who understand her complex needs, therapies that help her build skills and stay engaged with the world, medical equipment that keeps her safe, and caregiving support which helps me balance work and caring for her and her brother that will also help her live safely when I am no longer here. Without Medi-Cal, I honestly don't know what we would do. Now, I want to be clear. I know that Medicaid isn't perfect. I work with families every day, and I've experienced it myself. The system can be complicated. The wait times and denials sometimes don't make sense, and there are definitely areas where it needs to be improved. But drastically cutting Medicaid isn't the answer. Slashing a program that families like mine rely on instead of making thoughtful improvements is dangerous. For children like Violet, any disruption to their care can have devastating consequences. Delayed medication can lead to seizures. Losing caregiving and support can put her safety at risk. Gaps in therapy can cause children to lose hard-earned progress that they may never fully regain. When I hear of talks to Medicaid, it's not just numbers or politics to me. It is personal. It means questioning whether Violet will still have access to her medications, wondering if we'll lose the caregiving support that allows me to work. It means lying awake at night scared all over again, just like when she was a baby and I didn't know that we'd get through. And I know that we are not alone. Through the Connected Parent, I work with families across the country, families that are raising disabled children, many of whom rely on Medicaid just like we do. For these families, cuts to Medicaid aren't just policy changes. They are life-changing and they are life-threatening. I know budgets are complicated. I know tough choices have to be made. But I also know that families like mine shouldn't have to live in fear that the care that our disabled children rely on could be taken away. We can work together to make Medicaid better, to streamline services, reduce wait times, and meet families' needs more. But taking an axe to the system will hurt the very people who need it most. Violet is thriving today because of the support that she receives. That support needs to be protected, not just for my daughter, but for every child like her. Thank you for giving me the opportunity to share our story.
It's wonderful. Thank you. Beautiful. It is. I can just tell you from working in Washington with the families with children with other abilities, they are such a force. They were forced to pass the Affordable Care Act, to save the Affordable Care Act, and in addition to Connect the Parent, a little lobbyist very strongly advocating a presence on Capitol Hill, representing people from around the country, and those stories so important. When we listen to your story, just put yourself in that position without being able to have access to what you described. And again, even to make it better, which is always the case. But thank you, Julie, so much. Mark, I've known Mark over the years in Project Open Hand, and now he is the interim chief executive officer of Wu Yi Children's Services, which is, if you haven't ever been there, a very inspiring place to be. Thank you, Mark.
Thank you, Speaker. I'm grateful that you're here, as always, and to my fellow speakers, too. You set a high bar. My name is Mark Ryle. I'm the interim chief executive officer at Wu Yi Children's Services. And I'm going to tell you a little bit of a story and give you some data, and I'll try and do all that in 2 minutes. I grew up the youngest of 6 kids, and my job was to sit at the end of the dining room table closest to the phone so that during dinner when the credit collectors called, I could answer and explain why my parents weren't available. Sorry, it chokes me up whenever I tell the story. Why my parents couldn't talk that moment. It only took a second. It only took a small event to throw us off our course. They worked 2 jobs every day. They fought for education. And if something went awry that day, everything went out of balance. That's how precarious poverty is. And We see that in our work at UE. We see that with our colleagues at Kaiming and Emmons Mission Neighborhood Center in the work of helping children with Head Start and Early Head Start. And it's not just about the educational component in this work, although that is critical. It is about all the other factors. So a little bit of data for this. More than 92% of our families report that they're able to maintain their jobs and housing because of this child care. 75% report that they're able to come from a precariously housed situation or joblessness into stability because of the centers at Head Start and Early Head Start in San Francisco. Without these programs, our families fall apart and create an incredible burden on the system that's already overburdened and now slashed. Without Head Start and Early Head Start, we lose the momentum we build in children, we lose the beauty we see in their stories, we lose the power of what they will bring to our communities going forward. It just is unthinkable what we would do without these programs. They've been around for decades. They were started in part by Republicans, and silence in that majority is disgusting and a shame. I'll finish with the story. I'm not sure where I am on my time. We have a mom, her name is Milu. She has a 2-year-old boy, beautiful boy, who was diagnosed with autism, and she didn't know what the heck to do. She went to the school district, which is great and sometimes too big, and they had a rule, a regimen for her to go through, and it doesn't really work. It's complicated. It's unintentional barriers. So she came to Head Start, where she was surrounded with people who cared, who listened, who asked questions, who welcomed the environment of autism. More than 15% of our children are diagnosed with autism. It's an incredible opportunity for us to engage in a community and make them, rather than separate, part of who we are, and increase our services to serve those who need us the most. So with that, with Richard's help and all the political elements of San Francisco's funding, we know that the city will back us as the cuts come through, but without the federal government, we won't survive. So thank you for your help today.
Thank you. You've made that clear to us on many occasions. It's very tempting at listening to each of them to talk about what they talked about, but we're here again to listen, and then we can interact together. Nancy Netherland, a parent and caregiver advocate. Nancy, thank you for sharing your story with us. Thank you.
I'm the mother of 2 children who live with disabilities and complex medical needs. I'm also the founder of an organization called Kids and Caregivers that provides support to caregivers of kids living with complex health needs from the bedside to wherever they may need to go to advocate. I want to tell you what cuts in Medicaid will mean to my family. Over a decade ago, my husband and I, living in San Francisco, decided to become foster parents. And we decided we wanted to foster children living with incredible medical complexities who were least likely to find a home. And at that point, we became aware that foster children, our children, and 60,000 other children who are in foster care in California are covered by Medicaid. Or Medi-Cal. It's a form of coverage that they have for benefits. From there, we decided to foster adopt, and we adopted a sibling group with special health needs. Chris came to us with a failing liver and a grim prognosis. Lala was born prematurely and suffered from opiate withdrawal, cardiac issues, pulmonary difficulties, and we were told it was likely that she would be blind and severely developmentally delayed. It was only later that we learned that she had an incurable rare disease that now requires over 20 specialists and intensive medical care. We spend more time at the hospital than we do on vacations. Our lives have become a balance of biopsies and birthday cakes and medicine and magic. Up to half of the work week is dedicated to accessing disability services and medical care for the kids. And while this was daunting, we knew that our children, like over 20,000 other former foster youth in California, would get medical care and would be taken care of through Medicaid, and the disability supports that are afforded through things like IEPs also paid for through Medicaid. And while our lives required us to spend upwards of 20 hours a week juggling medical appointments, physical therapy, occupational therapy, infusions, medications, doctor's appointments. On top of just being regular parents, we considered ourselves incredibly lucky because we lived in a state that had Medi-Cal waivers or Medicaid waivers, and we also had access to children's hospitals and amazing services. We had confidence that we could be the parents that our children need to have a full and rich life. When we unexpectedly lost my husband, we lost access to commercial insurance, and these benefits and Medicaid became a lifeline that have allowed my children to participate in life-saving pediatric clinical trials, to get intricate and expert care from specialists, and to stay in hospitals that specialize in pediatric care. They also get the disability supports they need to attend school with other children and to engage in activities in the community. And when that hasn't been available, we've been able to get people into the home to do things like home hospital through Medicaid to make sure that my kids have access to the lives they deserve. And while I chronically worry about my children's health and the toll of their illness on their physical and mental well-being, I have not worried about getting them medical care. As Julie said, the system is not perfect, but it's a great start. It's a great foundation. I haven't worried until now. Medicaid is essential to a healthy America and to healthy communities. It's also essential to my family being healthy. And it's not just people on Medicaid who are at risk for harm. Over 50% of funding for children's hospitals comes through Medicaid. Medicaid funds the residency programs, it funds research, it funds fellowships. It creates the workforce that allows our most vulnerable children to thrive. Over 60,000 kids in foster care in California are covered by Medicaid. 20,000 former foster kids are covered by Medicaid. Of the 80 million Americans who are enrolled in Medicaid, there are 6 million children living with disabilities who get coverage regardless of income to make sure that they can fully engage with their potential and in their communities and benefit our nation. Special education services like speech, language therapy, occupational and behavioral therapies are all paid for by Medicaid dollars. Earlier today, I was on a call with one of my daughter's doctors making some really difficult, challenging, and heartbreaking decisions about her care. It was made easier knowing that I had access to experts, to people who've dedicated their lives to serving children like mine. And, sorry, a little choked up. The question that I've been asked recently is, what are you going to do if Medicaid is cut? How will your children survive? Where do we turn? And the groups that I run with caregivers, the caregivers are asking the same thing. When you have children with special health needs and disabilities, Medicaid is your lifeline. It keeps your children connected. Untreated, my youngest daughter's disease will dramatically shorten her lifespan. She's already lost years of her childhood to these illnesses and to chronic pain. My oldest child requires regular monitoring of his liver because of an elevated cancer risk. These need to happen through children's hospitals that are on the cutting block. What will happen without Medicaid and the ACA protections to children like mine? I don't know, but I do know this is just one story, and there are 80 million people who have stories like mine who can talk about how Medicaid has helped their families live full and rich lives. And while our futures are not certain, I am certain of one thing. My family and others will suffer if these Medicaid cuts go unchecked and this cruel policy moves forward. Thank you so much.
Thank you so much, Melissa. In Washington, we have a saying that we use home as well, that do not stand in the way of a mom or parent and the needs of their special needs children, because it's a losing battle for you. We cannot lose this fight on Medicaid. And one of the things that they're trying to do is distract everyone from this subject. Do you hear? I know, I said to a press person today, you never called me about Medicaid. That's central to what I do. You're calling me about buildings or whatever it is. That's interesting. This is urgent. This is urgent. So we have to keep putting it out there, the needs of our families, because families contribute to the needs of the children. I'm so proud of all of you. Somebody told me once a man said, an old man says an old man said to him, I don't know why everybody keeps praying for God to bless their work. Why don't we just do the Lord's work? that's what you all are doing. Thank you so much for that. So do you have any questions for each other? One of the things that you should know is, in addition to this, they want to abolish the Department of Education. Apropos of what we've heard here, Department of Education has a very Title I meets the needs of children in economically disadvantaged areas, and also Head Start, being not part of Title I, but Head Start that they want to eliminate or reduce in size. All of these things are about children who are poor. It's really heartbreaking. Now, if those children happen to have disabilities as well, if you combine it with Medicaid, it's just cruel. It's really just cruel. So don't let them distract you about one thing and another. We have to stay focused: Social Security, Medicare, Medicaid. One of the things they're saying is, why don't they're talking about work requirements for Medicaid now. And it's like, well, do you think these people can go to work if they're taking care of these children with special needs and the rest? Maybe so, but we have to have better, affordable child care. These things don't happen in isolation. So this is a big fight that we're having, because it's a fight between those who just want money to go to the wealthiest, who want to reduce the size of government. That's their plea. Now, if there's waste, fraud, and abuse, go after it. We always have. That's not the issue. But don't use that as an excuse to cut essential services to our children. So you have any questions for each other? Or any observations? As I said, you have your organization, you have yours, and as I said, we have a little lobbyist in D.C., just relentless, persistent, and not letting anybody forget about the needs of our children. And the children's hospitals do a remarkable job. If I just may personally say, we lost a close family friend, a teenager who survived all of this, all the disabilities that she had. And to see what the family went through all that time, and they were people of means, but without Medicaid, it would be almost impossible to meet Jacqueline's needs. Any questions for each other before we ask the audience for some? No? Okay. Do you have a question? No? Okay.
Hi, my name is Jennifer Libanati, and I am a single mother of 2 boys, Zachary and Haroon. They both have IEPs, and I've struggled with food insecurity for quite a long time. I've also grown up with food insecurity, and my father was on welfare raising 2 children by himself. So, this definitely impacts my ability to care for my children, as well as particularly the food. I am disabled, and so because of that, they drastically cut the amount of SNAP benefits that I receive, which it's already incredibly hard to feed 2 young growing boys, even with utilizing food banks and other, food banks in the city. I just never have enough, and in particular, like proteins and milk and eggs, all the things that you need to help the children grow healthfully. And I just want to say thank you for allowing me to share a bit of my story.
Thank you for sharing your story. As was mentioned, the farm bill that we are fighting over now is a bill that is overwhelmingly about nutrition, and that's the fight. We have subsidies for farmers, we have this, we have that, but it's overwhelmingly a nutrition bill. And when we had the majority, we were able to have enormous percentage of the bill be about nutrition, SNAP, all of the manifestations of distribution of food to people, and that's one of the fights. So whether you're talking about the education bill, whether you're talking about the farm bill, whatever bill you're talking about, they have a way of picking the pocket of people who need it most in order to give a benefit to those who need it least. But what you described is a great argument for why the Farm Bill has to be what that is. Did you want to say anything about the Farm Bill, anybody? Please. You mentioned it. Yep.
I did. I just think it's important to highlight that we need to preserve these types of programs in order for people in our communities to have food at their tables at the end of the day. No one should have to choose between having food or putting a roof over our heads. So it's important that things like SNAP, TFAP are preserved in the Farm Bill.
Any other questions from the audience? Yes, ma'am. Hi.
I'm Dawn Merton from Moms Rising, and I wanted to share another piece of Julie's story that you might remember when we were trying to pass the Affordable Care Act. Julie actually spoke because Violet was in risk of reaching her lifetime limits of care, and so Julie spoke at that time about how important it was to have the Affordable Care Act, and I wanted to thank you on behalf of Moms Rising for passing the Affordable Care Act, which I think is such a testimony to Julie, and also, made Violet be able to be with us today.
Yes, wonderful.
So thank you. We have gone through so many attacks on healthcare, and in the last Trump administration, we were able to fight back cuts and repeal of the Affordable Care Act. How do you feel like it's different now, and do you feel like we'll be able to do the same defense we were able to do then?
Yes, thank you, Donna, for your question. Thank you for your leadership. Donna was instrumental in establishing Moms Rising, and they have been incredible advocates across the country on so many issues that relate to moms' concerns, the children. We've gotten together on gun issues as well, and as Mark was speaking, I was remembering when I was a new member of Congress, I was visiting a child care center in San Francisco, little children like 4 and under, and a balloon popped, and the kids yelled, "Drop." Little children, hearing something that sounded like a gunshot, drop. And so it's been, shall we say, a further motivation to follow your lead on the gun issue that is so important to children's health as well. What we're going to do this time, as Donna has mentioned and Julie participated, last time when they were going after the Affordable Care Act, we had a plan around the country. We started actually in San Francisco right around the time of Martin Luther King Day, because Dr. King said of all the forms of inequity and inequality, the inequality of health care is the most inhuman, he said, inhuman, because people can die. So we centered our whole thing around Martin Luther King Day, planning it the day after the election of 2016 for obvious reasons, but launching it that day. We had 3,000 people at our first meeting here. But we had 10,000 meetings around the country. 10,000 meetings around the country where people told their stories. I said this earlier. It wasn't about provisions or polls or anything. It was about personal stories. What is more compelling than that? And it enabled us to hold the Democrats, hold most of the Republicans, and of course John McCain saved the day with a thumbs down that was heard around the world. But again, the Republicans were putting forth proposals that sounded good. Members would say to me, "This looks good for my district." I said, "Well, it's bad." And they said, "Well, you don't know my district. I know my district better than you." I said, "Well, I certainly hope you know your district better than I do. But I know the Affordable Care Act better than you do. This is bad for the bill. You cannot vote for this," because they were making appealing things that were supposed to be chocolate ice cream, but they were more like doggy do. It's just the way it is there, how they present it. So Moms Rising helped us with these 10,000 events around the country. Other groups did as well. And that was what we will do now. We've already started that. We launched the first 100, Martin Luther King Day, again. I launched the first 100, and that list is growing, so that people will be calling into the Republican districts and saying, I live in your district. Nothing is more eloquent to a member of Congress than the voice of his or her own constituent. So I say it's no use you calling into a Republican district. Have your friends who are Republicans call their representative, whether it's House or Senate, and say, I understand that there's a vote that's going to affect Medicaid. I want you to know that, and the more calls they get on that subject, it's really going to have an impact. We only have to win three Republicans, pull three Republicans over, and we already see some of them appealing to their leadership to say, I can't vote on this Medicaid thing, especially if they have a diverse district, actually. And so, so with some of them, again, SNAP, really big, calling in saying, you can't make me vote for this SNAP thing, I'll lose the election. And that's exactly what we intend to do, is to make them vote right or lose the election. Hakeem Jeffries, our leader, has organized so much of this in such an important way. In fact, as I close my remarks here, I will say what he has recommended for us to do, and that is to tell our stories. Whatever the agenda is, it could be ours, but here's his. Go to democraticleader.gov, share your story, tell your personal stories so we can continue that fight. But from our standpoint, what we're doing with our 10,000 events is to have people call their member of Congress, especially in the Republican districts. And if they're Democrats or Republicans, doesn't matter to us. I'm calling the Republicans to say, do you understand what Medicaid needs? The California Medical Society visited me in Washington last week, or maybe the week before, I forget. And they said they took a poll, and in California, 61% of the Republicans support Medicaid. And in the focus groups, when they talk to them, because of their own experiences, their own family experiences. So the story, their story, your story, all the rest. But I'm in awe of you, to Julie and to you, Nancy, because you have not only been champions for your children, but for all children with special needs in our country. Thank you again, Donna, for your leadership in so many ways and for being here today. Any other questions from the audience? Yes, ma'am.
Thank you, Madam Pelosi, and thank you to the panel. Jason Carey from Fly. I just want to sort of uplift the story. At Fly in San Francisco, we serve roughly about families and children who are greatly impacted and will be impacted by these cuts that we're facing. Roughly about 68% of the families in the Tenderloin District with high hills live in poverty. I'll repeat that. Roughly about 68% of the families in Tenderloin live below poverty. I want to share a story about a mom and child who came to our doors. When you come into Glide's doors, any door you walk in, we're going to help support you. Whether it be housing, whether it be food, whether it be basic needs, we're there to support you at Glide. We had a mom come in with her daughter, and she came in seeking housing. She came in seeking housing and food. We had people to support her with our case managers. And what we learned in the process of trying to support her is that there was no housing available for her. This mom was faced with taking herself and her child and living on the streets. A level of uncertainty that no one wants to face. What we came to understand is that many of our other partner organizations all face similar setbacks. Not having enough support, not having enough housing to support the families in which they are built to support. What we know is that we're going to face some really challenging times, dire times. And I'm curious if ensure that we are going online. But I also want to hear about what you think we are perhaps might be experiencing in the next 4 years. I'm just sort of curious. Like you gave insight about we've been here, we've done this before. But is this something different, Madam Pelosi? Can you kind of speak to that? Because those of us who are on the front lines, who are trying to hold and support families and children, are dealing with some things that we really are fearful of whether or not we're going to turn more families away for services.
I thank you for your question and for your leadership. I had the privilege of speaking at Glide a few weeks ago. It was a wonderful experience to see the new leadership and the, shall we say, prayerfulness of it all. And that's what's so funny to me, is that in certain segments of our society, I'm not talking about Glide now, I'm talking about certain segments of our society, people are churchgoers and they do all the praying. And sometimes I say they pray in church on Sunday and pray on people the rest of the week. They cannot, they just are part of what I was talking about now. And I keep saying to the bishops, talk to your parishioners. Tell them, feed the hungry. The Gospel of Matthew. When I was hungry, you fed me. When I was homeless, you clothed me. You sheltered me. When I was homeless, you clothed me. When I was in prison, you visited me. What is this about? What is our society about if we are not living up to the values and the vision that we claim we are doing? So this is a fight we're in. You used a term that I completely reject, 4 years, 2 years. Because we cannot allow, when in 2016, when what's his name was elected, we made a decision that we would win. He was going in after the Affordable Care Act, and we used that, 10,000 events, all the rest of it, to win the election in 18 so that we could stop him in 2018 and stop. And the only thing he did was that tax bill before we won with his Republican majority. That's what we have to do now. Hakeem must be, if I may just take the privilege of speaking politically for a moment or civically, Hakeem must be speaker in, 18 months? Is it 20 months? And 20 months so we can put a stop to this. But that's still a long time for them to do the damage to children who are impacted as little children growing up, to families that are so threatened by all this. And yes, it's different because we have to depend on the courts and we have to hope that they will honor what the Constitution says is their role. But nonetheless, that doesn't mean we hesitate in what we go out there and say. Now, as you probably know, last night the president made some kind of announcement that he was going after the Presidio. And everybody said, oh, he's going after you because that's your project. And I said, well, he can go after me all he wants. But my project are America's children, and I'm not going to be distracted. I mean, I'll look after the Presidio, I'll look after the federal building, I'll look after all that. That's important. This is urgent. And don't let anything they're doing out there with their shiny objects distract you from the fact that what they want to do is to cut these initiatives. Department of Education, Title I for the poorest children, Head Start, nutrition programs in the Farm Bill, the issues that relate to everything we talked about here, Medicaid. It's immoral for them to talk about that. And by the way, there's still a large number of governors in the United States who have not expanded Medicaid for the poorest of their children, Texas being one big state in that category. How can they look themselves in the mirror? Well, I don't know how someone can look in the mirror anyway, but that's a different story. So let me just tell you about the Presidio for a moment. The Presidio Trust Act was passed in a bipartisan way when the Republicans had control of the Congress. It was my bill when the Democrats were in control, but then we lost and they said, we'll help you anyway because it was bipartisan. We knew that we would be under assault We knew we would be under assault because there were people who just didn't want something new like that. So we had a strong statutory bill. We knew we were breaking ground, and we were not going to leave it broken. So when he comes after this and says we want to review what is statutory or not, he's going to find a model for the country on that. So we protect from assaults over time in its statutory. Statutory means there's a law that protects it. It's not a presidential, what do you call it? Executive order. It's the law of the land. And we're reviewing the language of the president's proposal, and we will respond to that. And we'll present a report in 2 weeks, as they say. But this is a one-of-a-kind national park site, and it's important. I'm not saying this to convince you of that. I'm saying this to say we're here to talk about Medicaid, Mr. President. That's what we're here to talk about. We're here to talk about Social Security and the disabilities piece of Social Security, which is so important, as well as Medicare for America's working families. You will not distract us with other things. So again, he's got so many things going, like he called himself a king the other day. Really? King of what? Anyway, the emperor has no clothes as far as I'm concerned, but that's a different children's story. So in any event, what we have to do is not think in terms of 4 years, to think in terms of 2 years, fewer than 2 years, like 20 months, where we will be ready because we will have made our case. In 18, and since then, he has said the affordable care, call it Obamacare. Excuse my French, but this is his book. Well, how did he say it? What did he say, Ian? So, Obamacare sucks. That's what he said. How distinguished is that? Obamacare sucks. And we said, no, it doesn't suck. It cures, Mr. President. And we're going to make sure it continues to cure. So that's part of our fight will be health care in all of its manifestations, people telling their stories. By the time the fall comes, this is February, it's almost gone. By the time September comes, we would hope to have the president's numbers down. They're going down, but we want them further down so that we can be ready for an election. People decide to run a year in advance. So a year in advance, we decide to have the A team to run, just in case you want to talk a little civics here today. But we're ready to win and to stop this thing. But a lot can be done in this 2 months, especially in the manner in which they are proceeding, he and his co-president, Musk. Yes. Can you go in the microphone?
Sorry. I think that Shakira and Noriko and the food bank probably are thinking this too, but one of the things Richard said before we got started today was that this crisis creates a coalition that sometimes, those are not your words, these are my words, creates a coalition that sometimes we might not have thought of before. And that there are plenty of Head Start and early Head Start programs in Texas, in Florida, that will realize the potential impact of this. There are plenty of food banks in states that might not have otherwise thought of it. Certainly plenty of community centers that do more than just community center work. And I think what we're learning is that we may have friends that we didn't have before.
Yeah,
And that sometimes is how you topple regimes.
Well, there's a lot of fear out there because people are afraid in their nonprofits in certain parts of the country. So when they see a drumbeat of support elsewhere, even though California is pretty strong in all of these areas, that gives them more confidence as well to go forward. But this isn't a campaign about talking about him or how he is. It's a campaign about talking about our children, their needs, what Medicaid means and the rest, and not, go so much after him, but to go after the policy and to convince certain 3 members of the House that they should not vote for this so that we can stop it. Just 3. That's all. Did you want to have questions from the press? Who wants to? B? B is from our staff in here. Yeah.
Good afternoon, Speaker Emerita. It's always an honor and pleasure to be with you. We're grateful for your leadership as always, and also for this beautiful panel of sisters and Brother Mark, who laid out the stories of need versus the greed that other people push on us. I'd like to ask, for those of us who are dealing every day with the most vulnerable people among us, those who are most worried, most afraid, and most susceptible to the dangers that the national administration is posing today, how would you advise us to channel our energies, our actions, along with some of the attitudes you've displayed already? How would you advise us specifically to go, whether it's here in California, where we're a little safer, a little stronger, but nonetheless still vulnerable to some of those attacks and the funding, of course. But how would you advise us to act and do so we can get towards those 10,000 people meetings? What was your advice?
Could you, for the benefit of everyone, identify yourself?
Richard, CEO of MNC Inspiring Success. Thank you.
Yes, indeed. Thank you, Richard. Well, as I said, it's important for Republican members of Congress to hear from their own constituents. Many people in the Bay Area are from someplace else. They weren't all born here. Their families live in districts that have Republican members, and they should be communicating back home to them. But the most important thing, even in California, we have 43 Democrats and 9 Republicans, that we could be calling them. In certain places, they're more vulnerable. In certain places in California, they're more vulnerable than in other places. And Central Valley has some places that could be receptive. But I'm not really allowed to name names and things like that. So, but did you have any? Because one of the things we learned when we did the 10,000, and Donna knows this, when we did the 10,000, we learned from the people who were telling their stories how they wanted to proceed. So do you have any suggestions about how to reach out to other folks?
I think co-locating our advocacy where folks are already receiving services is really important. I think educating more folks and understanding that we do have a bigger tent than we may realize. I think being singularly focused and not eating ourselves from the inside is really important. And making sure that we stay on message, right? This is about Medicaid. I also think that California will lead the way. There's certain amazing programs like CalAIM that have come out of the state that is looking at investments across our health system and housing and food. And so everyone has an incentive to do this. Everyone is impacted, from our farmers to our workers. And so I'm angry, which I hope many of you are, but I want to use our rage as constructive to kind of push forth and stay focused on what needs to happen. What you say, we said 18 months, 20 months, 19. It keeps getting shorter. Yeah. So I think that is kind of like the rallying cry that I'm hoping that all of us can fall behind for. So.
Our motto is we don't agonize, we organize.
That's right.
That's how we go
That's right.
forward. But in other words, when we're making the case about children with disabilities, it's better to have your language than our language on the subject.
Yeah, and I think there's an opportunity, right, for us to recognize, as you have in the past with the Affordable Care Act, the importance and the role that people with lived experience play in telling their stories and holding our politicians accountable. So I also really appreciate organizations that are providing resources to caregivers and parents and other people to learn how to engage in this process, because for now, where we are right now in this moment in history, we still matter, our voices still matter, and we can use our voices to try to impact change using the processes that are still in place. And so we need to support, and I know people do this, but just encouraging every agency to look for people that you serve who you can elevate and amplify and support their voices so that we have direct communication about how these cuts in Medicaid are going to impact our children, our families, our homes.
Beautiful, thank you. Thank you, Richard, for your question. Any press questions?
Press questions? Yeah, let's go, Joe.
Speaker Emerita, I have two questions about important but not
Two? Are two allowed? What's it?
I'm on your mercy here.
Oh, you're there, looking back there.
Thank you. On the Presidio, do you believe that
You were going to, as Richard did, identify for the benefit.
On the Presidio, do you believe that the IRA funds can be clawed back? That already been?
Well, we don't know. That's a matter of law. They are committed, and when they are committed, there's certain standards that are examined to see how far down the road they are. But the Presidio has been self-sufficient. The beauty of it has been it's been self-sufficient, and that was its purpose when we wrote the statute. But what happened, when Trump, what's his name, was president before, they put a bill in that gave not infrastructure, like water and electricity and those kinds of things, utilities, to the parks all over the country, except one. And so we were just making up in the IRA for what they hadn't put in the general bill. We all voted for the general bill, not to take anything away from anybody else, but they specifically eliminated the Presidio as one of the people would get the utilities. So that's not, and that was something that was owed from the start that we never got. So we have it in the IRA. Much of it, some has been spent, some of it is committed, and it's just a matter of law where they have to examine where it is there. And that's what we will do with that. But the Presidio, that's one aspect of it. It has really reached its goal in 2013 that it would be self-sufficient and no longer an expense to the American taxpayer. So it's quite a triumph.
And the other question was, you alluded to it about someone asking you about whether the president is targeting you with the federal building for closure, the Presidio being sort of your baby. Do you feel the president is targeting you because your name's on the building and you're sort of identified with the Presidio Trust?
Well, I think the president's targeting everyone. He's looking at 500 buildings around the country. In the list of initiatives that he put out last night with the Presidio as one of them, he had the Institute of Peace. Are you ready for that? The Institute of Peace. So it's just not me. People might think that because I have, shall we say, pointed out some of his inconsistencies with humanity in the past, and I probably will continue to do so. But the fact is that the list was not just one; it was a list of African American. Was it Inter-American Foundation? What was the African American? African American Development Corporation. The Institute of Peace. It was several organizations. But when we wrote our bill, we wrote it, as I said, prepared for an assault. The statute is very tight and purposeful. We'll see what their purpose is. But I won't get into whether he was going after me or not. I don't care about that. The fight he will have with me is on Medicaid. It's always been, it's about the children. It's about especially children with special needs, children or poor children. I'll fight that fight no matter what he has to say about this, that, or the other project. Oh, and the Affordable Care Act, Medicare, Social Security, and Medicare as well.
Dan Kerman with KRLA.
Excuse me?
There's some frustration among Democrats that we're not hearing a loud enough unified voice among Democrats in response to
Yeah, I think it might change, but I think it is there. I mean, every week since he was inaugurated, we had the first week here in San Francisco, we had the freeze. We had the event about the freeze. And then the next week we had the event, 17,000 people participated. We didn't get press on it, but 17,000 people participated in our town hall meeting on the Treasury Department. We had the chair of the Ways and Means Committee, once and future chair of the Ways and Means, Richie Neal, on that call, answering people's questions. And then this week we're having this meeting. So everybody is doing their work in their districts, and that's where a connection is. But Hakeem will, our future Speaker of the House, Hakeem Jeffries, he has regularly and recently, as yesterday, proposed how we will go forward with this and keeping people focused. No matter what it is he's talking about, we're talking about America's working families, health care, Social Security, all of that. And by the way, pointing out that he said he was going to lower the cost of living, it's gone up. It was going to lower inflation, it's gone up since he took office. So, yeah, again, as we get going, as we did then, 10,000 events starting on Martin Luther King Day, boom, into the future and into the election. Thank you. Anybody else? That's it?
One more.
Oh, one more.
Hi, Speaker Emerita. My name is Josh King. I'm a reporter for the San Francisco Standard.
Welcome.
To piggyback off of that last question, I've been talking with people in local, state, and national politics, and they feel like Democrats are running the same playbook they did in Trump's first administration. And
They did what?
Democrats are running a similar playbook to what they did when Trump was first inaugurated in 2017. But we haven't seen the kind of response on the street with hundreds of thousands, millions of people assembling. And I'm curious if you think the strategy that Democrats are implementing right now will be as effective, and especially what that means when you're talking about waiting almost 2 years to take that back.
Well, were they complaining about what we did in 2017?
Well, you could argue that Trump's
We won the election. We won 40 seats, 31 of them in Trump districts. But I do think that when we go forward now, we have to recognize the changes in technology and communication and the rest. It's a different time. It's 8 years later. So yes, we have a plan on how we will, proud of what we did then, 40 seats. But in addition to that understanding, we're in a different world now, and we have different technology, different communication. We have to reach people in the way they receive their information. And again, we have an expression, the plural of anecdote is not data. We have a lot of anecdotes about this and that. But what we have to do under Hakeem's leadership, and he is completely astute about the changes in technology and communication, and we have regular meetings to that effect. But forgive me for being rude about 2017. We won 40 seats. We stopped him in his tracks then. But again, it's a different world now today.
Well, I guess I should ask the reason people are not mobilizing the way they did in 2017 because of dissatisfaction with the Democratic Party.
Now?
Correct.
Yeah, but people are mobilizing. You know, we have maybe everybody's not on board yet, but we have health care is central. It's it's a health issue. It's an economic issue for families, for their economic health. So so many people come to the fore on that issue. The cost of prescription drugs is the one thing we couldn't do in the Affordable Care Act, is reduce the cost of prescription drugs because big pharma, all that stuff. But in any case, we did it in the IRA. The first time we're able to have the secretary of HHS to be able to negotiate for lower prescription drug prices. We want more we go to do a certain number, and the number will grow, and we have a formula for that. But we want more than that. What they want to do is take us to court to reverse that, because they're in the pocket of Big Pharma. Take us to the pocket to reduce IRA, period, because they're in the pocket of fossil fuel industry. This is in the pocket of the gun industry. You know, it's just, that's what they are. So we have more work to do now. We want better results, and we have to recognize the new technologies, the new way that people receive their information, and though I won't go into all of it because it's Hakeem's story to tell, but just as recently as Wednesday, when we were there this past week, they had present every week, but more current presentations about how we will go forward with this. And yet people are unhappy. They're unhappy. I'm unhappy. Geez, whiz, look what happened. Look what happened. And this could have been prevented, in my view. But look what happened. But the fact is that when they see a plan, if they feel encouraged, they will go forward. You have to show a plan, though, and that's what Hakeem will do. And that's what we did then. Again, that seems like ancient history now, but when you see a plan is when you get more cooperation. And people are signing up, and some people are still unhappy at every level, the grassroots level, at the donor level, at the intellectual level, and all of that. But again, I have confidence in Hakeem Jeffries, and I have confidence that he will be Speaker. And 2 years is a long time, but it ain't 4 years. It ain't 4 years. But thank you for your question. Thank you for being here. Anybody else? In the press? Yes, sir?
My name is Jerry Young from Penny Star. Thank you for your long-term advocacy for children and women. I want to follow the line. My Head Start colleague Mark and Richard talked about the concern about the Head Start, the continuous service for children and family, and also the workforce we have developed over time. But this is one pressing issue right around the corner. The Head Start CR continuing resolution expires on March 14th. Can you share your insight or projection about that bill? Thank you.
Thank you. Well, March 14th is the deadline for the keeping government open. And it is really important to keep government open. I'm very proud of Rosa DeLauro and Patty Murray, who are two women who head up for the Democrats the Appropriations Committee. They are at the table with the Republicans. The leadership is saying, oh, the Democrats won't negotiate. No, they are at the table with the Republicans, and the last thing we want is a government shutdown. But that's not what we're seeing on the other side, sad to say. It would be awful to have a government shutdown, but the last time we had one was when, what's-his-name was president, and it was the longest shutdown in the history of America, and he said, I'm very proud of the shutdown. So we've tried to avoid it all we can. It's not much time left. We'll start with the budget. They said we will maybe vote on it Tuesday or Wednesday of this coming week, and that's what they told us last week for next week. And so much is affected by a shutdown. But if you don't believe in governance, see, what we have is we have some people who don't believe in science, and they don't believe in governance. So if governance tells you that you have to do this, that, and that for the health of our children, and the clean air, and the this or that, if that's what science tells you, and governance proposes rules for it, two no's do not make a yes. They don't like governance, and they don't like science. So it's hard to convince them that having a shutdown is bad in every way for the air we breathe, the water our children drink, the rest of it. But again, we're still Rosa, she's our contact on this, she reported to us yesterday, actually, here. Not here, on Zoom for the caucus, that they were still optimistic that they could keep government open. But it's not up to us. We do not have the votes. They have the votes. And again, we try to convince 3 people not to vote that way. But if that's the path that they go down, the public has to know. The public has to recognize that their interests are not served by people who don't believe in any governance and the rest. Here we have a situation where very wealthy people who don't want to pay taxes, their fair share of taxes, and do not want their businesses regulated, clean air, clean water, any of that, are now in control. So if government is shut down, that's not a problem for them. But their appetite for tax cuts for the rich may be such that they will keep it open. But all we know is every single day, you have to agree on a top line. What is the figure that we are using? And we have to agree on what the increase is for military, the defense, and we want it to be commensurate with what is there for domestic. We don't want domestic to be cast aside because we have serious needs. So the top line and the equity, the consistency between military and that. Now they say they're going to cut military, but they're going to spend other military money on drones and things like that. Maybe that's a good idea. I mean, we need to upgrade our military, that's for sure. But I can't really tell you what they will do. Only they can tell you what they will do, but let us hope that we find a path that they could. Now, of course, in our own country, there's a debate. If that's what they want to do, let them do it. Let the world know. And then others of us saying, well, let's at least try to get this done. But if they insist upon it, the public has to know what it is. It costs billions of dollars to the taxpayer when we have a shutdown of government. But thank you all so much for your questions, for being here. But let us applaud our panel. Weren't they wonderful? We have Nikita Lim-Temper, Noriko Lim-Temper, Shakira Simley, Julie Walters, Mark Ryle, and Nancy Netherlands. Thank you all so very, very much. And thank you for your questions and for your participation. And don't forget, we don't agonize, we organize. Nothing more eloquent to a member than the voice of his own or her own constituents. So get calls rolling in California as we are across the country. Donna, thank you for honoring us with your presence today. You've been so remarkable. Thank you. Thank you all so much.